or suggestions for the website should we send to you, please, by all means, if you have a good idea, please bring it forward and we'll see how we can integrate that. Jan, thank you. Christy, Westfield Mall and Palm Desert can offer abundant space. Christy, yeah, we understand fully. Western Coachella Valley need a location as well. Indio may be too far, especially for those residents that are more at risk. We hear you. And so the incident management teams under the leadership of Kim, as well as Bruce, are looking into these locations. And obviously, eventually, I think we'll be making decisions. They'll be making decisions as to what locations make good sense. Les, I feel your frustration. I think we all do. And the point that you're making here, the feds and the state expanded eligibility due to reports of vaccines being wasted, quote unquote, as well as the growing viral spread. Was there no way to expand to age 75 plus before expanding to 65 plus? That's the question. Couldn't the county have limited to 75 plus due to the supply? As a result, the public is very distrustful that the county state feds knows what it's doing.
Yeah, I think that's a great point, Dr. Zundel. And the short answer is it would be problematic either way, right? Because the governor announced that people are eligible to get the vaccine if they are 65 and older. And so if we restricted that, then we would have people that are between that 65 to 74-year-old range that would be very frustrated. And so, we tried to do what we thought was best in terms of opening up availability to and being consistent with what the state was doing and what the federal government also recommended. So we were trying to be consistent with both the federal and state guidelines. And it is absolutely a challenging message and challenging when people don't understand vaccine supply is limited. But we're trying to remain consistent and get it out as quickly as we can.
And mind you, as well on that front, we have Chuck Washington, supervisor from the 3rd District, who's part of the governor's kitchen cabinet. I actually am on the kitchen cabinet as well. And from one day to the next, we have these kitchen cabinet conversations so that we could coordinate and consult with. It hit us by surprise, just like everybody else here on this Zoom call. From one day to the next, we went from, the discussion on tier 1 and who's going to be vaccinated to actually opening it up to 65 plus. And we didn't even know that was going to happen until basically the mandate came down, or the request or the press conference that the governor had a couple of days back basically indicated that's the direction that he wants us all to move towards. So obviously it makes it more difficult for all of us. Palo Verde, are there any plans for a COVID vaccination clinic center to the Palo Verde Valley area? Is a question that we would like to respond to as well. And Indian Wells Tennis Garden could potentially be a location. Obviously, we'll look at that as well. Chris, thank you for that. Let me see here. Does anyone have, Kim or others, a response to Palo Verde?
Yes, Supervisor. So absolutely, we know that we need to get vaccine out into the Blythe area. And so whether that is through a county mobile team going out and setting up for a few days like we've done with testing, or partnering with other providers that can go out there, those are the options we're exploring right now. And so those plans will be forthcoming.
Thank you. Nancy Ross, how will vaccine patients who have underlying medical conditions validate this?
So that is an excellent question. One of the things that we are challenged with is how much detail can we get into people's personal medical history, and how much will that slow things down? How much will that create additional bottlenecks? So we don't have good answers yet for that. We're still kind of sorting through that with the state. But I think that's a big concern and particularly depending on which comorbidities we use, that could be huge swath of the population. So more answers to come as we work through this with the state. I don't have a good answer right now.
So we'll follow up on that. Thank you, Kim. Earlier today, we were talking about what we saw in the social media platform and the news. And I think Stephen is bringing it up here as well. What do we know about actually receiving more vaccines? The Washington Post is reporting that the vaccine reserve is already exhausted. What does that mean moving forward, right? Especially when it comes to expectations. I'm not sure we've had any calls with anyone at the federal level at this point since this morning, or even at the state level to validate that this is the case. Do we know anything about this, Juan or Kim?
I don't, Supervisor. We do have calls scheduled for this afternoon, so I'll probably get additional information. But I think regardless of what we find out, Councilmember Hernandez's point is well taken about just reinforcing to people that that vaccine supply is limited, and people have to, understand that and be patient. And I know that's not easy to relay, but that's the message that we all need to keep telling the public. We're going to get the vaccine out as quickly as we get it.
Great, thank you, Janelle. Is there an administrative, Janelle Percy is asking, is there an administrative fee associated with the vaccine?
So Supervisor, providers are allowed to charge an administrative vaccine. The vaccine is being provided free from the federal government. But if you go to a provider's office, they may charge an administrative fee. As of right now, the county is not charging an administrative fee. We are providing the vaccine for free of charge.
Okay. Carmina, I'm not sure what you meant, but you stated, Carmina Savannah, would that create confusion for the public? I'm not exactly sure which part are you referring to in this discussion. So if you don't mind, maybe resending.
Okay, I will.
And we have Glenn, good point. Glenn Miller, can we get a small memo from you on the information that was provided today so that the information can be distributed all in one memo along with easier access to our community? Our networks are very different and gives everyone an opportunity to get essential information to more people. By all means, I think we're going to put together a news release, and we'll put together some sort of one pager, if you will, bullet point. That way we could get that out to folks. The more information I believe that we can put together and provide you so you can give to your constituents, to your networks, I think the better, especially because of the misinformation that might be out there. So that's appreciated. The ag community has reached out several times, but it sounds like there is a plan in place for them. This is from Katie Stice. Thank you for that. She's asking the question, do we have a plan? And will this actually take place next week? And Katie, it's been brought up to our attention now by quite a bit of people besides the Desert Sun, as well as even Blaine Carrion. I had a conversation with him this morning and others. And so would you like to address that, Kim, as far as
Absolutely.
our mobile sites and how we're going to, what's our plan look like when it comes to farm workers?
Yes, thank you, Supervisor. So as I mentioned, we did meet, I think it was last week, with Janelle and Growing CV and some of the folks there. So our hope is that we'll be able to start vaccines next week. Again, depending on vaccine availability, we need to get another shipment in. And so we are looking at doing mobile teams that would go out to the grower sites. But then Janelle has also identified some drive-through sites that could be appropriate out in those communities. And this afternoon, we are meeting with Desert Healthcare Foundation and providers. So once we meet with them, then we'll be able to firm up that plan and get it out to Janelle and all of the growers in the valley so that they know what to expect.
Yeah, one of the things that's been brought up as well to my attention is the concern around literature. It's obviously in Spanish, besides English. And so people are wondering when can they expect that information to be able to hand out to their farm workers. For example, there's one employer that has up to 900 farm workers. And so how soon can we get that information out? I understand that we're putting together the plans, but what do you anticipate there, Kim?
Yeah, thanks, Supervisor. So I think as soon as we can nail down dates and times, and again, in order to do that, we need to know that we have vaccine coming in and when it will arrive. But as soon as we can nail that down, we'll get flyers developed and out through Janelle and any other network that's available for us to distribute that. But in advance of that, we also have been working with CBOs, community-based organizations that do a lot of work in the Eastern Coachella Valley, and they have been doing education around vaccine hesitancy, what to expect, education on COVID. So really trying to get messaging out so that people are ready for the vaccine when we can get those clinics off the ground and running.
All right, great. And we'll have we'll have more answers, I guess, later today after the 4 o'clock call. Hello, Assembly Member Chad Mays. I see you there. Thanks for joining. I got a question here going back to Carmina. Question for Kim. Kim mentioned that the individuals that received the first dose vaccine, they can go to the same provider or go somewhere else for the second dose. I was wondering if that would create confusion to the public.
Yeah, I think that that's a great point. And I think that that comes down to our messaging. So when people are coming into our pods, I can tell you that I've been right there with the team, and what we tell people, we give them an immunization card, just like you got when you were a kid and got your childhood immunizations. On that card, it says which manufacturer of vaccine they got, what their date was for their first date. On the back side, it has the date that the second dose is due. And what we tell them is they can go back to our website and sign up and come to another pod, or they can also go to pharmacies or to their providers if they want. So we really try to walk them through that when they're there with us.
Thank you. There's a few more questions, and I know that media is on the call as well, the Zoom call. So if you have questions, media, by all means, go ahead and write them down as we're going through these last few questions from local leadership. Christy brought up that she believes some counties are using their own websites and forms to do registration for vaccines and clinics. Could the county do that instead of the state website if it isn't working? It is discouraging for people who go through to sign up and then find out that it's full at the end. They may be less likely to try again.
Yeah, so I know that Brooke will have an answer to this too in terms of the website, but what I can tell you is there are a couple of jurisdictions in California, Los Angeles and San Diego being two big ones, that do not use the California Immunization Registry. They have their own immunization registries that have been established for many years. And so their process is a little bit different than ours. And so while technically we could build something separate, that would require then that we would have to build an interface into the California Immunization Registry so that all of that data transferred, or we would have to manually enter it into the system. And that's very resource intensive. So there are problems either way that we go. And so that's why we're really trying to work with the state to get some modifications made so that it is more user friendly on the front end.
Brooke, do you have a response to that as well?
Yeah, I just wanted to add to that, to the specific point about individuals the other night who were going through the registration process, and that, which is somewhat lengthy, and then getting to the end and seeing that there were no more appointments available. So we are aware of that. And we did update the site yesterday morning so that we removed the links and listed full for each one of those clinics. So I just want this group to know that we're going to follow that process today so that as soon as we see that the clinics are full after the appointments have been opened up, whether that's today or it's sometime over the weekend that those clinics are full, we're going to remove that link from the county page and list full so that individuals aren't then clicking on the link and, as you mentioned, going through that lengthy registration process to see that the appointments aren't there.
Okay.
Thank you, Brooke. Chris Freeland.
Supervisor, if I
Go ahead,
may
Juan.
add to that too, just to again put it in context. So we opened up 5,600 appointments, I believe it was Wednesday evening, Brooke, and they were filled within 2 to 3 hours. So they're literally moving that fast. So that is the challenge we're trying to manage. And at the end of the day, it is really the supply issue that we come down to. That ultimately our goal is to get it out within a day or two at the most as we get it, as Kim has mentioned. But we're going to continue to see the sites filling up and folks experiencing that frustration as long as the supply chain does not get expanded. The demand is just that high. It is literally selling out, if you will, as soon as they are opening.
There's a question here by Chris Freeland. Albertson's website is requiring folks to confirm they are in tier 1A. Are the other tiers allowed with them or not? And you mentioned, Chris, disregard the Albertsons. It has been updated. Don't know what Albertsons is doing. I'm not sure if we're following that along on our end, what these grocery stores are doing. Kim, is there communication with those folks on an ongoing basis or?
Yes,
not necessarily?
we are communicating with them. They are getting vaccine through a different network because they're national chains, but their supply is also very limited. And my understanding is that they are remaining consistent with what our spot is in the tiers. So they are open to 1B as well.
You know what, Kim, since we're speaking about that, we're talking about Albertsons. Can you speak to the issue of long-term care facilities and their vaccination process? What's going on there with the Walgreens and the Rite Aids, I guess?
Happy to. So the federal government, CDC, negotiated a partnership with CVS and Walgreens to vaccinate skilled nursing facilities and long-term care facilities. It has been moving slower than all of us would like. I can tell you the last report that I saw, which was towards the end of last week, showed us that just over half of our skilled nursing facilities had their first visit from either CVS or Walgreens. We are monitoring this very closely. We're trying to put pressure on them to speed this up. And absent that, then we are going to be looking at ways that we can help with vaccinating that population. We know that population is vulnerable. We know that population has a very high mortality. And we're talking residents but staff also. So in that population, it's residents and staff. Again, the challenge is that the state is allocating CVS and Walgreens vaccine for that effort separately. And so if we supplement that, then we're drawing down off of our allocation. And so we're trying to work with the state to see if we can negotiate, we'll use our allocation and then they backfill us or something like that. So we're trying to work through those details now with the state. And at the same time, encouraging increased speed with both CVS and Walgreens.
Okay, thank you, Kim. I know that there's some questions for the media as well. Please write them in. We got a hard stop in 13 minutes. Lisa Olmstead from Congressman Reese's office. Have all health clinics received the vaccines for their employees? They're hearing that many have not.
Yeah, so there are probably clinics that have not received vaccine because they either have not applied to become a COVID-19 vaccine provider or they have not been approved yet to become a COVID-19 vaccine provider. We did send out communication to all providers in Riverside County through the Medical Association, and that went out to members and non-members, as well as we hosted on Wednesday, I believe, a call that was opened up to community health centers to let them know about the application process. And so, we're trying to get the word out to everybody that if they want to become a provider, they have to go through the process. And then once they go through that process, they can get vaccine allocated to them. However, so those providers that have not been approved as COVID-19 vaccine providers, they still are eligible to get vaccinated through our pods or through other locations that have vaccine. So there's a couple of different avenues there.
Thank you, Kim. Thank you, Linda Evans, for your write-up here. It's not necessarily a question, more of a comment. Hospital distribution process with the county is working very well. Thank you. Like testing, once supplies were more available, the capacity increased significantly. We need to continue to work together on this. The county needs us to help this effort be successful. You're absolutely right. And we appreciate your point, and we appreciate all of you that can help us roll this out successfully. Obviously, this is a very important question as well. And the concern around our farm workers and potentially the availability of vaccines. This is from Rebecca. If the public health department uses up all of its available vaccines this weekend, will there be enough for the farm worker vaccination effort? When do we expect the farm worker vaccination effort to begin?
Yeah, so Supervisor, we definitely want to start the farm workers next week. And so we historically have received at least a shipment a week. So we do anticipate that we will be getting additional vaccine. As soon as we get that vaccine in, then we will launch. And that vaccine has to go to providers. It has to supply our pods and then our mobile team so that we can get out to farm workers. We won't get through all of them next week, but we'll definitely get started and get a cadence going so that we do get through all of them.
And could you explain as well, Kim, you mentioned it earlier, earlier today in a different call, around the percentage of vaccines that we actually receive. I mean, out of the 114,000 vaccines, for example, that we've received, how many of them actually come to the county? What's the percentage of those that actually come to the county? And then what's the percentage that go to private doctors, if you will, or other entities?
Yeah, absolutely, Supervisor. So we have been keeping, as the county, about 20 to 25% of the vaccine that's allocated to Riverside County. The rest have gone out to providers.
So even when it comes to that, the amount of vaccines that we receive is not as much as we'd like it to be, regardless, just because of how they're being distributed.
Correct.
Kathleen, it's clear on the website now that all the clinics are full. I think you're right. Stephen, is it safe to say if someone got the first dose, they'll get the second? What happens if they have trouble getting the second? How effective is one dose?
Yeah, so the state feels confident. They have told us at the local level that they think that the supply chain will support second doses. So that's the assumption that we're working under right now, that we will continue to get those shipments of second doses and get them out to providers. As I mentioned earlier, if you don't get it on day 28 or day 21, depending on the vaccine, it is still effective to get it later. And you don't have to restart the series. It's a boost to your immunity. And so you can still get the second vaccine. In terms of efficacy of one dose, the initial studies showed that the Pfizer vaccine was between 50 and 55% efficacious with the first dose, and around 75 to 80% efficacious for the Moderna vaccine for the first dose. So you get some level of protection, but obviously we want to encourage people to get that second dose, because that's really going to boost your immunity and get you up to that 95% that we're seeing with both doses.
There's a question by media, NBC Palm Springs. Is there a way the county can direct phone calls away from partnering vaccination distributors? Ralph's and Albertsons can't fill prescription because of so many calls. I'm not sure if does that make sense to staff?
So I'm guessing that their phone is ringing off the hook, just like ours is, and probably many of you, with constituents asking questions. And so, as I mentioned earlier, we are setting up with Office on Aging has already set up a phone hotline. We're working with 211 and United Way to do that, to increase their capacity to handle calls. They're already accepting calls for us. And so we are trying to find ways that people can get information in a centralized way. But people are savvy and persistent. And so if they don't get the answer that they like, then sometimes they answer shop, right? All of us know how to do that. So we're doing what we can to try to make answers available. That doesn't mean that people won't try other avenues.
I'm just getting a text right here, right now, that appointments are available now. Is that correct? Greg?
Hi,
Okay,
Supervisor,
so
this
I'm
is
saying
Brooke.
yes.
Yeah, they
Right,
just
Brooke?
went live.
The website just went live and we're working on getting the news release out right now.
Okay, perfect. Maybe this is a question for our friends with Office of Aging, but maybe we can address it here. Let me see here, where is it? Are there any services for homebound seniors who are not in assisted living to get the vaccine?
Yeah, so we are, this is a tough area. It's tough to identify everybody and figure out how to resource this. We are working with different groups that serve these communities. We're talking with home health. We're talking with different folks like that. So I can't say that we have a really strong plan on how to do this. It is on our radar. We're trying to work through it the best way to reach these folks and make vaccine available.
Jan Harnick is asking, are the first and second dose the same?
So if you get a Pfizer vaccine for your first vaccine, then your second vaccine needs to be Pfizer as well. And if you get Moderna, then Moderna. So you need to keep with the same manufacturer.
And then there's also a difference in the amount of days, correct?
That's correct, Supervisor. So Pfizer, your second dose is 21 days after the first dose. For Moderna, it's 28 days.
Thank you. Second doses must be given priority appointments within their time frame. That's from Pam Scano. Grace is asking, will the county be advocating for other essential workers to be included soon? I believe your office is aware of the petition that is requesting domestic workers be included in these initial rounds. I can appreciate that point. I have not seen the petition though. But have we had internal conversations on this front here with domestic workers?
Yeah, Supervisor. So the recommendations are set for context. So the FDA reviews the clinical trials. They work with ACIP, or the Advisory Committee on Immunization Practices. They make recommendations. The CDC director signs off on them and says, yes, those are our recommendations. They also are developing the tiers. Those go to the state. At the state level, we have what's called the Drafting Allocations Work Group and the Community Vaccine Advisory Group. Those two groups are reviewing the federal recommendations and making slight tweaks based on California's epidemiology. And then those are passed down to the locals. So we are not making changes to the state's recommendations. They're statewide. And so that continues to be a topic for discussion at both the Community Vaccine Advisory Group and the Drafting Allocations Work Group.
Thank you for that. And thank you, Deborah, Gary, your question or your thought here to be helpful as community leaders. How can we best assist the county and county healthcare providers moving forward? And I think the suggestion that was brought up earlier as well by Glenn Miller is a good point to make, and that is to make sure that we provide the correct information to the community as much as possible. I think that's going to be important because of the misinformation that is out there. It was brought up earlier as well, I think by Juan, our interim CEO, about the fact that there are people calling us and wanting to be helpful and saying that potentially maybe their site can be a site for vaccinations. And so obviously we'll take that into consideration by all means. Earlier, I think Chris asked the point around suggestions or ideas for the website. For sure, please send them, and we'll see how we can integrate your thoughts to make sure that we're a little bit more effective with our website and communicating our message. Staff, your thoughts on how potentially we could, the community can be more helpful, or our leadership can be more helpful. I also know that cities are interested in being helpful with vaccinations. And so that potentially might be an area. Our school districts, maybe another area. But I want to just open it up to staff as to where potentially we could use further support.
So thank you, Supervisor. I'll add a couple comments, and I'm sure Kim and Brooke may want to add some as well. So I think it's several layers. First of all, one really important thing is what we're doing here. So I applaud you, Supervisor, and I think the leadership for coming together, because the more you are aware of the challenges, I think the more we can all use our different forms of communication to inform the public of the situation. So I very much appreciate this type of forum here today. We do know that, as we look ahead, we're going to be vaccinating folks for a long period of time. That is just the reality, given the supply chain, the reality of 2.5 million residents in Riverside County. So we are very much having to continue to expand our efforts as we go and sustain them for a long period of time. So we will need additional sites. We will need additional staffing resources. We will need to be able to, rotate folks in and out to be able to do it. We'll need to expand our networks. Again, we've been using a lot of networks through our private providers, and we need to continue to grow and expand those as the supply chain can feed them, if you will. So please, we very much appreciate your offers of assistance. And if we let you know that, maybe we can't take advantage of it today, check back, let us know. We just have to keep this communication going, because at some point, we're going to need to keep expanding those networks. So I just want to thank all of you. There's just tremendous interest in doing that, and we're all in it together to get the vaccines out as quickly as we can. So Kim, I don't know anything you want to add to what I said.
I'm
Well,
actually,
you said it perfectly. Thank you.
okay, thank you. Listen, it's 1 o'clock, folks. I was going to say we're going to have a hard stop at 1 o'clock. Obviously, we got some more tweaking, more work to do. We may decide to do this next week, earlier in the week, to be able to provide you an update and what we were able to accomplish over the course of the weekend, just to keep you in the loop.